Hello everyone, I am Dr. Vishesh Gupta in Department of Conservative Dentistry and Endodontics, BBD course, Lucknow. Today I will be dealing with pulp vitality tests. Now what are the common pulp vitality tests? First of all, it is a thermal test that includes hole test and heat test. Second, electric pulp test. Third, test cavity. Fourth, anesthetic test. And fifth, bite test. Now, what is the need of this pulp test? Why do we do it? First of all, to assess the status of the tooth, whether the tooth is healthy or a dead tooth. Secondly, to know the pathological status of the lesion, whether the pathology is pulpily originated or it is periodontal originated. Third, about to know the origin of the pain, whether it is a pulpal pain or it is a pain from periodontal tissue. Next, what are the four possible outcomes of this pulp test? What we are going to get the results. First of all, either the patient will complain of no response. Whenever we test a patient with any thermal, electrical or any other pulpatory test, the patient will do not respond to it. That is no response. Secondly, a moderate transient response. That means in a normal healthy tooth, in a normal individual where the tooth is healthy, we will get a moderate transient response. Third, it can be a painful response that subsides quickly after the removal of stimulus. The stimulus can be a thermal, that means cold, or heat agent, electrical in the form of electric pulp testing, or any others. But it should subside as soon as we remove the stimulus. Next response is a painful response that lingers on even after the removal of stimulus. That means whenever we remove this thermal testing agent or electric pulp testing agent, the patient still have a sensitivity of pain or a sensation or a discomfort for prolonged time. That means from seconds to minutes. Next slide. There are two major responses clinically which we are seeing, but they are misleading responses. What do you mean by misleading responses? That means they are not accurate response or a reliable response. What are these? These are named as false negative response and false positive response. What is false negative response? Whenever the pulp is vital, but the patient does not respond to any pulp vitality test, that response is known as false negative response. What are the conditions that occurs or that gives this false negative response? First of all, condition is immature apex or the apex is not fully formed. Second condition is recent traumatized tooth, wherever a patient has met a trauma or accident and that status in tooth, it has come to an OPD for a pulp vitality test. In that case, it will give always a false negative response. Third case, if a tooth has sclerosis or calcification. Next, the patient with psychological disorders. That may also give a false negative response to us. Next, the patient with pre-medicated with analgesics or anti-inflammatory drugs, so that their pain potential is very high. They will not respond to the normal pulp vitality test. Next, patients with high pain threshold level. These are the all conditions where we get false negative response. Next, coming to false positive response. This is also a misleading response. In this, pulp is non-vital, but the patient gives a response to the pulp vitality test. Now, what are these conditions in which we get false positive response? Let's come and see. First of all, it's a case of anxious patients. If a patient is very anxious, he will obviously raise his hand before we test or before we conduct any test because of his anxiousness level. Next is in the case of acute alveolar abscess or phoenix abscess. In this also we will get a positive response. Next case, it will be in a multi-rooted tooth where in a root or in a root canal of that multi-rooted tooth there lies a vital pulp. but other canals having a non-vital or necrosed pulp. Next case is improper isolation, wherever the operator is not properly isolating that tooth while conducting the pulp vitality test and the testing agent contacts the gingiva. Next case is the patient with low pain threshold level. Next, it is evident in the case of gingival polyp. What is gingival polyp? A gingival polyp is nothing but a hyperplastic condition of a tissue or of a gingiva. It is excessive growth. In this case also we get a false negative response, false positive response. Now coming to the first pulp vitality test, that is thermal test. This test includes cold test as well as the heat test. In a normal healthy tooth, the sensitivity wears off immediately after the removal of the testing agent, whether it is a cold agent or a heat agent. The response to this thermal test indicates a vital pulp, and any abnormal response to this thermal test indicates there is a pulpal or periradicular disorder or disease. Now coming to first test, that is cold test under thermal test. What are the different agents by which we can conduct this cold test? These are cold air blast, ice sliver or stick, ethyl chloride spray, dry ice or also known as carbon dioxide snow or also known as frozen carbon dioxide stick. Next agent is difluoromethane known as DDM or Freon. Next agent is 1112 tetrafluoroethane, or it is commonly available as Endo ice spray. Out of these all testing agents, dry ice or the carbon dioxide snow has a good advantage of being, it gives a reliable results even on the tooth which we have a full coverage crowns. It will give or it will respond to this cold test if we test it by dry ice. Next, what are the various temperatures of these cold testing agents? One by one we will see. Ethyl chloride spray has a -4 degrees Celsius temperature. Difluoromethane or the freon gas has -21 degrees Celsius. Ozone-free tetrafluoroethane or Endo ice has -26 degrees Celsius. Dry ice or carbon dioxide snow has a range of -56 to -78 degrees Celsius. The disadvantages of cold test. What are the major disadvantages? First disadvantage is microcracks or crazed lines on the enamel surface. Whenever we are going to keep this cold testing agent more than the application time, it will cause microcracks or crazed lines. Crazed lines or microcracks are incomplete fractures. That means partially fractured. It is not completely splitting the tooth, but it is going to a certain length in the enamel region and then stopping it there. Next disadvantage is pitting on the porcelain restorations. That means if we keep our cold testing agent more than 5 seconds in an application, the pitting is going to cause on that porcelain restoration. Next disadvantage is soft tissue burn. Whenever an operator is not isolating that tooth properly, the cold testing agent touches the soft tissue or the gingiva and causes a soft tissue injury or a soft tissue burn. These are the disadvantages of cold test. Next, moving on to heat test. It is the thermal test. The agents involved in the heat test are warm air, gutta percha stopping or commonly known as hill stopping, hot ball burnisher, hot water, polishing rubber wheel. Among these listed agents, the best agent is gutta percha stopping or hill stopping. The GP stopping is heated just short of smoking and applied to the junction of middle and cervical third area of the tooth surface being tested. Here on the right side, you can see a picture in which a white stick, which is known as gutta percha stopping or hill stopping, is being doing a pulp vitality test or a heat test, and the ambient temperature for this is 65.5 degrees Celsius. This temperature change is enough to elicit the response from the pulp. If the patient tooth feel the heat response, he may raise his hand and then indicate you that the heat sensation is being produced in this tooth. If the heat sensation is there, the pulp will be considered as vital. In case of metal restorations or metal crowns on the tooth, the heat is produced by a rubbing polishing wheel kept on the lingual surface of that crown, which is mounted on a slow speed handpiece, micromotor handpiece preferably. Next test is electric pulp test. It is done by a special instrument or equipment. In the figure, you can see the electric pulp tester. Now, what is electric pulp tester? It is a battery operated portable instrument that uses varying grade of electric current to produce the response. Its voltage ranges between 15 to 300 volts with an ampere output of 0.5 microamperes. What are the parts of this electric pulp tester? As you can see in the picture below, there is a lip clip, there is an electrode or probe tip, and there is a rotatory dial. This is the rotatory dial, this is the lip clip, and this is the probe tip or the electrode. Now, before its usage on the tooth surface, the tooth should be kept dry and should be properly isolated. A non-fluoride gel, especially the toothpaste without containing any fluoride in it, should be placed on the junction of middle and cervical third of that isolated tooth surface. Gradually, the dial is kept moving on the electrical tester until the patient feels a heat, that is light, or a tingling sensation. If this is felt, then the pulp is considered as a vital. Now, what is the principle of working of an electric pulp tester? The electric pulp tester creates the stimulus by the pulp nerve fibers. It stimulates the pulp nerve fibers. Primary A delta fibers are responsible for this response. The electric current is formed by keeping the electric pulp tester probe tip on the gel coated tooth surface to be tested and attach the lip clip to the angle of the mouth in the oral cavity, followed by rotation of the dial or the rheostat in an electric pulp tester gradually. This is the whole working of the electric pulp tester. Next, what are the factors that affect the response of this electric pulp test? First factor is the enamel thickness of the tooth. As you all know that enamel is an insulator. So if it is a thick enamel, that means the insulation will be more and conduction of the current will be less. The response will be feeble. Next factor is the probe tip placement on that tooth surface by the operator. If it is placed a little above the middle third junction, then obviously there will be a lot of enamel surface and that will act as an insulator and hence it will decrease the response level. Next is dentine calcifications. If there are dentine calcifications in that particular tooth, the circuit will be partially non-conductive. It will be a hindrance to that circuit. Next factor is interfering restorative materials like in galvanism. Wherever there are two dissimilar metals in an electrolyte, this phenomena occurs. And in this phenomena, there is a non-reliable response. Next factor is pain threshold level of the patient. If a pain threshold level of a patient is too high, then we will get a negative response from that patient. These are the factors affecting the responses of electric pulp test. Next, coming to the advantages of electric pulp test. What are the advantages? In trauma cases, the electric pulp test gives us the reliable results because here the vascular supply may be hampered but as the electric pulse test relies on stimulation of the nerve fibers, so it is a good, reliable result giving test. Next advantage is it is a quick test. Next advantage, it is less tiring and less technique sensitive as compared to the other thermal tests or other pulse vitality tests. It is operator friendly. It is a portable instrument in this electric pulse test. Next is it is controllable as compared to the heat test where gutta percha stopping controlled or ice lever, that is ice stick controlled environment, is impossible for an operator. Next, what are some disadvantages of electric pulse test? The use of electric pulse test in patients of a pacemaker is questionable. That means the results will not be reliable in case of patients with a pacemaker. The results may vary due to the battery condition of this pulse tester. The unreliable results is seen in cases of a large coverage restorations, crowns, bridges, or splinted teeth. These are all the disadvantages of electric pulse test. Next test is the test cavity. It is done whenever the other vitality tests are inconclusive. What we do in this test cavity test? We prepare a small cavity by help of number 1 or number 2 round burr, but without LA administration into the suspected tooth. We do not administer any LA and we perform a cavity preparation preferably with a number 1 or number 2 round burr. If a pain sensation occurs, then the pulp is declared as a vital. After this pain sensation in that particular vital tooth, the cavity should be temporarily restored with zinc oxide eugenol cement. In case of no pain is there, then we continue the endodontic therapy on that particular tooth. Next test is anesthetic test. Whenever the patient is unable to locate the painful tooth, this anesthetic test is performed. What we do in this anesthetic test? In this test, administration of local anesthetic agent is done on a single tooth, that too intraligamentary injection only. The most posterior teeth of a quadrant is anesthetized first. In the pain, if the pain is still present, then we move on to the tooth, one tooth mesial to it, and then try or repeat the test. If the pain disappears, then the current anesthetized tooth is marked as a culprit. Next test is the bite test. This test is done when the patient complains of any pain on mastication or while chewing the food or while biting on the tooth. What we do in this test, the patient is asked to bite with the suspected tooth onto the biting agents like cotton roll, like orange wood stick, or the tooth sleuth. They are the devices which are there in the market and they help in the bite test. They help in the checking bite of that particular tooth. Pain on the biting with the tooth sleuth indicates there is a fracture in that tooth, which can be further confirmed by the trans-illumination test. That is a confirmatory test. Next test is intraoral periapical radiograph test. It is used as a universal diagnostic aid to find the carious lesion involvement, whether pulpally involved or periradicularly involved, through the radiographic interpretations. The radiograph also helps us to trace the diseased tooth whenever the patient is unable to locate the tooth and there is a presence of a sinus tract. How do we do it? We do it by a sinus tracing or the GP tracing, gutta percha tracing. These were the pulse vitality tests which were common in clinical situations. Now, what is the takeaway message? Always relate the clinical pulse vitality test in order to reach to a final diagnosis and thereby laying a definite treatment plan. Do not rely on any one particular pulse vitality test. These all the tests should be done on a single tooth. Then you come to a diagnosis relating with the patient symptoms, patient history, and thus dealing or creating a definite treatment plan. Now this lecture being concludes here. I will take another topic next time. Thank you.